Thousands of federal employees have been laid off with their lives completely upended. Elon Musk and Trump have demonized these workers and stripped them of their humanity. But these people, your neighbors, have names, and they aren't just in Washington, D.C. They're in Alaska, Nebraska, Texas, Florida, Georgia, Pennsylvania, Oklahoma, Oregon. These people have food to buy, loans to pay, and kids to feed. These people wanted to work for the federal government because they wanted to help make America a better place to live. That includes Arielle Kane. Up until Saturday, she was working at the Center for Medicare and Medicaid Innovation under the Department of Health and Human Services. Shortly after she got her termination letter, she tweeted directly to Elon Musk, "Hey, Elon Musk, your Doge minions just fired me and my colleagues at CMMI. We were working on improving maternal health outcomes at lower costs so that less pregnant women would die in this country. I thought that would fit nicely into your agenda." The administration told the media yesterday that the HHS cuts were targeted and didn't include scientists or people working on Medicare and Medicaid. Well, I know of scientists who got fired, and I work on Medicaid. And Arielle Kane joins me now. Thank you so much for being here, Arielle. And give us a few more details on what your job was.
Thank you so much for having me. So I worked at as you mentioned, the Centers for Medicare and Medicaid Innovation, which is a small office within the larger agency. And the goal was to make Medicare and Medicaid even better. They're already pretty good. They're already pretty efficient, but there's always room for improvement. So I worked on one of the models, as I mentioned in my tweet, the one that was working on maternal health.
And how did you find out that you were laid off, fired?
Well, so obviously I follow the news, and I knew that people who were in this probationary category, which I was, were being fired across HHS. And so I was compulsively checking my email. And after a run, I logged onto my computer, and my colleague had pinged me that she had gotten the notice. And then less than an hour later, the exact same notice popped up on my computer. And I had to call my own boss after receiving that email and tell him I was fired.
Wow. And what did the notice say? What did it say was the reason for your termination?
So it cited that my inadequate performance, I forget the exact verbiage, and also that my role is no longer needed at the agency.
And do you know how many of your coworkers, how many people on the staff that you were working on were also let go?
So unfortunately, because of the chaotic way in which how it came about, I don't know how many people across my office, across CMMI were affected, but I do know how many people were impacted on my team. And of a project team of about 12 people, depending on how you count, 4 of them were terminated on Saturday. And 6 more feel very, very vulnerable and feel as though their time is imminent. And so if you take a 12-person team and you cut it by 10, I'm not sure what's left.
Yeah. And what does that do? I mean, give me some of the pragmatic impacts that that's going to have on people who are on Medicare and Medicaid who were counting on your office.
Yeah. So again, Medicare and Medicaid are already like very efficient programs. Most notably, Medicare has 2% administrative costs. So everyone is already kind of the people who run the programs are already operating. You know, we have full workloads. We're working hard to make things run smoothly. And so my biggest fear is that in cutting all these people, these benefits that people rely on, and of course, for me, my program, the program that I hold dearly, that we're not going to achieve the goals that we want. So for my program, for the maternal health program, we were a new program, but we were working to reduce the maternal mortality rate in this country, which is an outlier in all developed countries. And we were just getting off the ground, so I'm not going to say we had, you know, a boatload of evidence to prove that we were going to be effective, but we were working with states to implement evidence-based strategies. And I'm just worried that without my team, those strategies won't be implemented and we won't make gains on something that we know we can do better on.
And regardless of how, I don't know if you want to talk, you want to share how you voted in November. Is this what you expected this reorganization, this search for efficiency to be like?
Yeah, so I'm happy happy to share. I did not vote for Donald Trump, but obviously I've known since November that he was going to be the next president. And I figured, there would be changes at CMMI. Every administration should be able to emphasize the policies and programs that fit within their agenda. And I was expecting that. I also thought that our program would continue. Our program is a state-based program, so our partners, our counterparts that are implementing the work are 15 states, and they include states like Mississippi, Alabama, Louisiana, Kansas. These are not beacons of leftist policies, and so and to be specific, like I work directly with Mississippi, and so I thought that this would be just like a nonpartisan issue. Like, we all care about moms and babies. We all want them to have healthy experiences, healthy births. And I thought our project would continue. And to be fair, I don't know the outcome of our project. Like, I'm just fired, so I no longer have insider intel, and maybe it will hobble along. But it really makes me sad, because I know the work we were doing was so important, and I thought it was bipartisan.
Yeah. And it should have been bipartisan. Arielle Kane, we wish you the best of luck. Thank you so much. You would think. Thank you. We appreciate you and wishing you all the best. And